Hi everyone, welcome back to another lecture by Matthew McKenzie, care activist. Um, if you visited my video or YouTube channel for the first time, just to let you know, I raise awareness a lot regarding to unpaid carers and the work that they do in order to care for someone, perhaps in the family or friend, close neighbor who is going through long-term illness. And a lot of the videos and blogs that I do usually focuses on mental ill health or even cancer, to be honest. I do have a group regarding that. But this time, again, I suppose, because I do have a few videos regarding this initiative from NHS England. But this time I'm looking at PCREF again, and this video is mainly aimed at those who are on involvement. I want to say involvement, I mean patients and carers who are helping to shape services at Mental Health Trust. And I will obviously mention a bit of what PCREF's about. So apologies, PCREF actually stands for Patient Care Race Equality Framework. Bit of a mouthful, but obviously with these videos, I will try and raise as much awareness as I can. I can't always do that, but it helps if you are involved in this, I'd say, great initiative, really. One of the questions asked at many of the groups that I attend is who should be at the table regarding race and equity or equality initiatives at mental health trusts. And again, for those who might not know, PCREF is actually aimed at mental health trusts. The reason being is that those who are from minority backgrounds are not getting the best service as they should do. But I won't really talk too much into that because it might take away from the things I'm mentioning now. If you want to know more about that type of thing, I do have videos on my YouTube channel, which I suggest you watch or even read. Some of them up. I've written them up. So as a reminder, this is aimed at those who are involved. And when I say involved, that means shaping services, um, looking to improve outcomes, but they're but you're not staff. You're from the community, minority community. You're on an involvement register as maybe a carer, PCREF lead, or patient, or PCREF patient lead. You have that lived experience, or you even a group. To be honest, may have a group of carers from the local mental health trust, and you want to see that change, you want to see that difference, but you're not sure who should be involved at that mental health trust, at that hospitals, um, or in the community regarding mental health services, who should be involved and who's not at that table when they should be. Obviously, no discredit to mental health trusts. I'm sure there's plenty, and many of them doing excellent work on PCREF. But this is also, just a reminder, suppose, really, that there are important key staff that patients and carers need to look out for. And if they're not there, then there is a risk that important decisions might not be made and you might not be included in those decisions. If they're not there, they might be making the decisions without you, or they might not understand, they might not know what PCOF's even about. And I'll also see if I can put in the video description a link to this new initiative. So let's start really. What is PCREF? And again, I won't go into it heavily because otherwise it'll just take away from the things I'm going to mention here, and I don't want this to run on long. Otherwise, it can put some people off. So basically, it's, as mentioned, it's the Patient Care Race Equality Framework, and I usually call it PCREF for short. And it's a strategic approach, obviously launched by NHS England, aimed at addressing racial inequalities in mental health care. And they are there. I know there's those that sort of say, well, no, there isn't. And, why black people, Asian people moaning about this type of thing? They're all the same. I do have a video on health inequalities, showing important reports as to prove that there are health inequalities, race problems, discrimination problems, and that is to come, to be honest. Continuing on with this is to ensure minority patients and those that support them receive equitable, culturally competent support. It focuses on important access, engagement, and outcomes by integrating cultural awareness, empowering minority patients and carers, and promoting inclusive practices within mental health services. So if we continue on this, the theme of this particular lecture, it's looking at key staff. As a warning, though, there is other staff and other key, I'd say, collaborators as well that are missing, but the ones mentioned here are definitely key. If they're not at that table, there is a risk that your voice isn't going to be heard, or you just don't know what they're thinking or what they're. Because the point of PCREF is leadership, really. That's one of the things. You need that leadership there, otherwise people are just being pulled and pushed all sorts of places, and there's no guidance. So let's quickly go on to this. And apologies if I'm, going too fast. To rewatch the video, if you feel that I've missed something. Very first and very important is you do need your senior leadership and executive team. And when we're talking about who's in that team, it's got to be the chief executive officer. Before any launch or anything, they've got to acknowledge that there is discrimination. The organization needs to be anti-racist, and there needs to be better outcomes when it comes from minority or vulnerable groups. It's not always just ethnic. We've got LGBTQ plus, got traveling communities, and a lot more. So, and I will do a video listing out, those who are vulnerable, and where PCREF may more likely will cover. Obviously, from my background, I'm more focusing on ethnic minorities, to be honest. But as you can see here, that your chief exec should be providing, leadership that ensures PCREF aligns with the trust strategic goals. Remember, there's a video I did. Probably if you go back 2 more videos, there's one thing I mentioned about policies, um, goals, things like that. It's got to mention PCREF. It's not in there, something's not quite right. So that's something you want to be looking out for. If that person's missing, then where's the leadership? Obviously, it still filters down. Obviously, that your chief exec officer needs to champion the initiative and allocate necessary resources in order for PCREF to succeed at that mental health trust or integrated trust, really, because some NHS trusts do have mental health and acute services as well. And one of the big things about PCREF is not always about mental health. You've got physical health as well. Going on, you've got your equality, diversity, and inclusion lead, or I would say a lot of people in the NHS would say EDI for short. So leader director, they're almost practically driving the thing. So, they take, and they were there obviously before PCREF, to be honest, but this PCREF gives the extra focus this time on those initiatives. Now, your EDI or Equality, Diversity, Inclusion lead should be taking responsibility for embedding PCREF equally across the trust and monitoring its progress. And you're there, if you're on involvement, you're there to help monitor, and you're there to ask questions, query things, influence as well in partnership. Obviously, what you don't want to do is bark and bite and argue. It's not a healing environment. I do understand that does happen. Your ED also has to help drive initiatives, and I did mention policies, focus on diversity and inclusion. Now, a quick one on this one. They're not expected to know it all. They're not. But there's no reason why they can't learn and be influenced by what you're saying. So it's so important that if you use those services and you're from a minority background or you're an ally, of minority groups, and you're passionate about improvement in health equity, mental health equity, do get involved, and be heard. And there will be challenges and be a long road. It's not a short sprint. It's a long, long marathon, this one, and it's not going to be something that's solved in a day. Um, but don't expect them to know it all. That's what I'm trying to say, because that's the importance of the training aspect. And I will get to that bit, because that's a very important key staff when it comes to those things. But what we're trying to mention here is, these are almost leadership, well, they are leadership really, and they're responsible, and they need to be sort of held to account in a diplomatic way, of obviously. Let's continue, and I believe I have 9 slides worth of this stuff. So your medical director also is a very important focus on this one. And here, what your medical director and director of nursing will be doing is integrating the patient care race equality framework principles into clinical governance and service delivery models. Another quick thing I need to mention is, you're not expected really to know all some of the stuff that they do. It's a lot, and some of it's really complex. Another way you can influence is to make things, try and nudge them to make things simpler for you to understand. I could say confidential, well, in confidence, that the mental health system is very complex. Psychiatry, psychology, in its nature, is very complex. It deals with complex things, and unfortunately, to make matters worse, it's not confined within those settings. When we're talking about racism and discrimination, and disenfranchisement, it's out in the community as well. Poverty, education, all that sort of thing makes it even more complex. But you've got to start from somewhere. So these are your first lot: your chief exec, those on the board, your EDI, quality diversity inclusion lead. What's your medical director doing? The director of nursing, what do they know about PCREF? What are they doing? How are they engaging? Where's the leadership? And there's a whole lot more things you might want to ask and learn from them, and influence them as well. So let's move on. So we've got your clinical and operational leaders, and here they ensure that the framework is now integrated into mental health care delivery, across patient, community, and crisis services. They also need to be included in, because they oversee staff training, service improvements based on PCREF principles. And again, this is where your chief exec comes in, or the managers actually need to make sure that this space and resources are allocated for training the staff, because I know there's a tug of war. I see this often, where staff are not trained because managers won't allocate them. They say, no, you've got to do your job. You've got to make sure the patients are supported and looked after. You've got to do your other roles, so they won't train them. So there must be a reminder, and it's not going to be easy, obviously. It's definitely not going to be easy, but there needs to be space allocated and resources so PCREF can be implemented into service delivery. Basically, this is what this is looking at. So you need your managers and clinical leads on board, and if there's issues, they've got to raise it. They can't be silent, and just get on with it. They also got to say, look, what are these challenges? How can we work together? Then you've got your psychiatrists and psychologists, and remember, there are complexities in this, but here, psychiatrists and psychologists, what they do is they need to make sure, and you won't, I promise you, not all of them are going to agree with PCREF principles. That's part of the challenge. But they got to identify and address disparities in diagnosis, treatment, and outcomes for minority ethnic patients. They also have to help develop culturally competent care pathways. Again, there are engagements and meetings and opportunities to meet with psychiatrists and psychologists and others really that are working for your local mental health trust. But if they're not there, if they're hidden and you don't know what they're thinking, you don't know if they care or if they want to get involved, then it's going to be really tricky. It's going to be challenging to know how PCREF is being implemented or if they even care. Um, but that's one of the reasons I'm sort of mentioning this, and I think this is an important lecture for those involved in order to look for key staff. And another reason I'm mentioning this lecture is that there might be situations that your organization might be lacking resources or training to let patients or carers or those from the community know who should be at the table. So that's what's one of the reasons I'm mentioning this here. I'm not saying they're doing this on purpose. It might be a resource issue. So let's go on. Other key staff would be obviously again, these are key. No point of having PCREF if there's no engagement, because therefore no one will know about it. So therefore you would want your patient and care engagement staff, your PPI leads. Um, my local trust is South London and Maudsley, and I'm involved in a few other mental health trusts as well. And usually these take the strain in engaging with the community, engaging with carer groups, the ones that I do, service user groups, trying to get feedback and trying to help implement those feedback into the service, into the decision makers. They shouldn't be gatekeepers, though. You should also have a chance to access and feedback straight to the board when there's really big events. Have meet them there. Their role, and there is others actually. It's not. I'm only mentioning just the one. Coordinate patient and care engagement activities to ensure their voices guide PCREF related decisions. There are other things they're responsible for when it comes to PCREF, but that's one of the main things. Do get to know them. If you don't know them, ask, who's responsible, who helps provide engagement, who is supporting yourselves in that engagement into the community. Because without that, then it's hard to guide PCREF successfully at your local mental health trust or organisation. You then got the care leads. Again, this is a bit tricky because they're not just known as care leads. You've got care champions, you've got care support officers, you've got care peer supports. They're numerous, but obviously, and again, another thing I need to mention, I tend to come at this from the carer angle. Um, so you may have leads for patients, services. I really don't know. I'm just coming at this from the carer aspect, but here your carer leads represent and advocate for the carers' perspectives, particularly those from racialized communities. Um, you may also have, and I'm one of them, a PCREF carer lead, basically on involvement. They're not staff, but they actually can be a PCREF carer lead. But I suppose what gives it the extra boost for PCREF is if that carer has that experience, not only of someone in receipt of those services, but also the lived experience of going through the discrimination, the first-hand experience of um, caring for someone who's gone through the health inequality situation. There's that more of that relation. So you may get them, but you also got your other care leads who were assigned, but even before PFF came out, to engage with carers who are supporting someone using those mental health trust services. So yeah, they're still representing, they're still advocating, but this time there's that extra edge where it's focused on racialized communities, and here to also keep building those partnerships with external organizations to support carers. So those will be your local care centers, perhaps, or communities that are geared towards minority groups. Could be religious communities, mosques, churches, that sort of thing. Again, not expect the care leads to just up and jump and know it all. Again, they would need support and training, and they will get things wrong. I know there's situations, and I've seen it, where people will bark at them saying, "Oh, you should have known this." You should. Wait. if they knew this in the first place, PCREF wouldn't really need to be here. Um, so they need that support as well. They need that guidance, and they're obviously there been a need for a lot of training. And in your role or involvement is, I say, the best way is influence and activism, not barking and arguing. I'll expect, obviously, there to be arguments. I really do. But if you can avoid it, I think it'll work out the better, to be honest. We also got your equality and inclusion champions. These will sit on your staff networks and they act as internal advocates for race equality, sharing insights from frontline experience. So it's not just about the patient and the care, it's about what staff are experiencing um, at the mental health trust services as well. And I did mention in my other video, yep, they are prone, unfortunately, for this, to be discriminated against. Um, a big ask. Well, I wouldn't say big ask, but one of the questions. It's not a big ask. That's unfair. But what they're trying to ask for is that there should be more minority groups being on board, being promoted, and not being pushed out when it comes to including voices. And this is your staff networks as well. Those providing services because they have the understanding of what those marginalized communities come from. I'm not saying replace completely, those who are initially there. That's not going to work. But we need to notice those that want to get the opportunity to engage with the marginalized communities, and no tokenism either. You can have, staff from marginalized communities that still don't believe in the ideals of PCREF and still they don't quite fully understand that there's problems with health inequality. They really, and I've seen it. So that would be a tricky one. But then this again, this is key staff equality and inclusion champions. Continue on. You got your, and this is another big one because it leads on to what I've just mentioning. You got your HR. So this is your work and development training team. So again, they would lead on the recruitment, yeah, retention and progression of diverse staff. Some of the things I've just mentioned. And they will ensure that the trust has policies in place to prevent workplace discrimination. I've mentioned this, so I've sort of jumped the gun again. But it's important that they should be at the table. What is the situation? Why is there high? I've got the word for it now. But when I just put it in this way, when staff from minority groups are pushed aside or taken up on practices when it's unfair, what's going on here? What are the policies there to protect the staff, or is it just there to look pretty? Why are we losing a lot of minority staff? What's going on? Why are those who are leaders, who are on the board, where's the minority groups there? What's going on here? Do you see what I mean? And it's a whole lot more to it than that. But those are the questions or influence you wanna be sort of trying to work out with HR. Um, if you want to make your organization anti-racist, this is one of the best places to start because it's your staff. So again, ensure the trust has policies in place to prevent workplace discrimination, deal with the anti-racism, and this is again learning and development teams. So delivering anti-racism cultural competency training for staff at all levels. This is going to be tricky, I think, because what I've mentioned before, if it's not mandatory, staff might just continue on with their workload. I have this problem with care awareness training. There's a lot of the stuff here is not mandatory, so staff might skip it and say, "Well, yep, PCREF, we understand, get on and do their work." And there's still problems with racism, bias, cultural competency. So they might, again, this is going back to your leadership. They must place those resources there, and your role on involvement, if you're carer involvement, patient involvement, even public, might sort of influence and query, how is this being delivered? What education is going on for staff? Or even if you're, a staff champion, Like, inquire about it. How can you get training on this ongoing education on PCREF and its goals? So who else we have? We've got the, and this is again very important. I've mentioned this in my other video. It's all about the data. It's all about proof. It's all about the quality improvement specialists as well. Because without that data, you don't know what's changing, you don't know what's adapting. Um, and if you're on involvement in shaping services, you probably need a bit of training and support yourself to even understand that data. But here, they will use the data, the proof, to identify and address racial disparities in the access to the services, experiences of those services, and outcomes. And this is again where your voice is so important because without a doubt, they should be at the table taking your views as well. They will collaborate obviously with other teams to monitor the impact of those interventions without, and if they're not at the table, something's not quite right. How can you know the PCREF is working at your organization? And again, this is something I'm sure the CQC will be looking at as well. And when I say CQC, I'm not with the Care Quality Commission, who are there to inspect mental health trusts. So, yep, analyze patient demographic and care as well, to be honest. It's not just the patient, but and also look at the outcome data, identify inequalities, provide evidence where changes are needed to improve racial equity and health equity. So continuing on, we've got your community and external engagement teams. So those not just on the inpatient but outside in the community. I have experienced situations where I don't really think that there's some trust that actually even have them. But if they do, and I hope they do, if they're hiding somewhere, you need them to foster partnerships with the local minority ethnic. And I did mention faith groups and advocates earlier on. Your public and patient involvement leads will probably be doing a fair bit of that as well. If an organization, a mental health trust doesn't have one, you might want to inquire how on earth are they going to engage with the community? Because it's a big job, to be honest. And it's not just putting up an event and seeing who turns up. There's lots more to it. But it doesn't mean those on involvement, care, and patient can't go away and help provide links to the community. And that might be one of the expected things. I've known many who go off and do it and bring trusts on board with being that bridge to the community, and all good for it, as long as there's a bit of support as well. You don't want the situation where the organisation just asks you to do it and sit back. I think that's unfair. But it's about partnership as well. If that's something you can do, and I'm sure I'll present on something on that, it's all the more for welcome for it. Also, your community engagement officers, they'll ensure services are informed by the needs of the local population. A big role, big, really important role, this one. But without them, it will be a challenge on engagement. And I'm sure PCREF, one of the principles is looking for those very things. How is the mental health trust engaging with the community? And I think what I will do in 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 a following lecture is, look into what their roles are actually, because I'm sure there's a lot in regards to engaging with the community. Then you got, I don't think there are many of these at all, to be honest. And to be fair, some of these roles might be merged into other roles. But if your organization has something like that, you're very lucky. The key staff, obviously. So they're going to be working with the third sector organization, your care centers, your mind or rethink branches, minority sectors, third sector sectors. The sad thing is, I do think they're struggling out in the community. The third party sector organization, there is a funding issue, and unfortunately, I've come from the situation where a lot of them seem to be closing down. That's going to make it really tricky for this to continue when it comes to engaging with the voluntary sector. But yeah, if you have something like this, I think you're lucky. But here they provide culturally sensitive support and advocacy for patients and carers. Continuing on, this is now your what you probably would know a lot more about, really, if you're involved in shaping services and shaping PCREF. And if you're in receipt of services, obviously these are the ones you more likely will see: your mental health nurses, your AHPs, allied health professionals. And with training, they will help deliver culturally responsive care and provide feedback on barriers faced by patients and carers, obviously, from racialized communities. And they probably experience quite a fair bit as well, so they shouldn't be ignored. These are your trust frontline staff, your peer support workers. Again, this is a tricky one. I don't think many trusts have have them, and some of them I've known are actually even provided from your third sector. But they're there. But I don't think they're that common. And again, they're going to be the ones that represent the lived experience of the mental health services. So they should be involved in order to feed back and also be that bridge with the community, help shape PCREF at that organisation. So if you have a peer support worker whose role is to engage and support minority patients, absolutely key. They should be at the table in helping to develop PCREF into the services. And this, talking about trust, they also help to build the trust in those services as well. So we're almost coming to the end. Governance and oversight teams. So what do they do? And if they're not at the table, what 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 could go wrong? Basically, these are your trust board members. They actually hold your leadership to account. I used to be a care governor some years ago, well, many years ago, to be honest, at my local mental health trust. And I feel like you have to be fairly skilled because you're holding the board to account. As I mentioned, here's why I've included this bit here, and I'm talking about it. But it's again now this time one of the added roles is on race equality initiatives. So they're going to be looking for a lot of the policies and trying to remind and influence and make sure again that your organisation's got PCREF on the agenda. It's tricky because with board, well, not just governors, sorry, but board members do know who they are. Because the reason I've put governors is because I'm linking to governors as well, which are important. But your board members, they're usually held to account by the governors. I would say get to know your board members. Obviously, you're not going to be easy to get hold of because again they're very busy, but they should be at the table and there should be some form of engagement. And I was told this when I was a governor, get to know your board members, obviously. So there's two. You've got your governors and then you've got your trust board members. And I was sort of a bit distracted by thinking in my old sort of role as a governor. So board members, obviously, they receive updates on PCREF implementation and outcomes. It's the same thing as governors will. They'll receive it as well. So on involvement, if there's ever meetings regarding PCREF, it'd be important to say, well, who on the board is promoting this? What are their thoughts? What sort of things do they need to update us on? So it's a two-way feedback mechanism. It's not like you're constantly feeding back. What are their decisions to help drive that leadership? And this one is absolutely important. Without feedback or complaints or even compliments from patients or carers, you don't really know what's changing. If there's a load of complaints regarding racism and discrimination, I think that's almost a good sign because this opens up what the issues are. I'm not saying that you're going to be straight away solving what they are, but you know that they exist and that there's proof of it. But you do need them at the table. It's going to be tricky and challenging, I think, in trying to get them to open up and being transparent because the nature really of complaints is people don't like them. They don't like saying, "Oh, something's gone wrong." Um, but with the influence of the transparency, the outcomes will be better. But we do need those feedback teams, we do need PALs, patient advice liaisons, you do need engagement. Um, and the tricky thing really is that there's a habit of teams saying there is no problems, we're perfect, nothing's wrong. And that's something on your involvement you're going to have to try and check and double check and sort of say to them, well, hang on, look, we're involved in because we need to specifically look out and empower patients and carers if they come across things that is discriminatory. It needs to be fed back. I don't think it's easy, but it's absolutely key, and this links back to data as well. So why are these roles crucial? And I've got to wrap it up. The implementation of PCREF involves systematic changes across recruitment, care delivery, patient involvement, care involvement, community engagement by involving staff from diverse areas of expertise and responsibility. NHS Mental Health Trusts can, obviously, and this is, I'm being very, very brief, there's a whole lot more to it, can address these racial disparities in access, experience, and outcomes, continue to, and help promote accountability that goes to your leadership. And I've mentioned this word time and time and time again, is transparency. You do need that culture in your organization when it comes to transparency. Without that, it's going to be a hard road in achieving these equality goals. Ensure sustained improvement through collaboration. I should have put that in bold. It's all about collaboration and shared responsibility. Again, these are the teams and people, not all. I've missed a huge amount. There's a lot more to it than what I've presented here, but it's a start. These need to be at the table. They need to be accountable, influenced. Not all are on board. That's my warning to yourselves. If you're on involvement in trying to shape these services, trying to make a difference, not all will care, or they'll think, oh, it's just the same people moaning again. Some will take it as far as to say that that's not in, interest of psychiatry or psychology. So you will get outdated thinking. It's not me cussing off the mental health system. It's not that. It's just saying that these things are hard to change. But the most important thing is we now have a framework and backed by the Mental Health Act that shows the sad fact that health inequalities, racism, discrimination, it's there. Otherwise, why are these minority groups getting a bad deal? Why? The thing is to ask yourself why. But if you made it this far into the lecture and not got bored, thank you. Do give a like if you can. I hope it's been a bit of an education. It's a start, and it's there to equip you if you're passionate about changing the really bad deal vulnerable groups, minority groups, travelers, gypsy communities, religious groups experience for mental health services. And thanks for watching. I'll promise to revisit. It's not just on PCREF. There's stuff outside it that is involved regarding PCREF, and I think yourselves may need to take note of. I'll promise to revisit those in the future. Take care and look after yourselves.